Let's go. The brain needs three things: glucose, oxygen, and the blood supply to deliver them. Today, we are going to concentrate on the cerebral blood supply. Let's start with cerebral perfusion pressure. That is the mean arterial pressure minus the intracranial pressure. The intracranial pressure is usually relatively constant. Cerebral blood flow is maintained and constant across a wide variation of mean arterial pressures by way of vasoconstriction and vasodilation within the brain. But there are limits, and when the pressure is too low, the result is hypoperfusion and tissue ischemia. When it's too high, the result is hyperperfusion, and this causes tissue damage as well. It may result in diffuse leakage of fluid into the tissues, causing edema, cerebral edema that is, or if there is a weak spot in the vasculature, it may rupture. Vascular abnormalities like aneurysms and areas where small branches take off at sharp right angles are the most vulnerable to rupture. The circulation of the brain is divided into the anterior and posterior circulation. The anterior circulation is supplied by the internal carotid arteries on either side. The posterior circulation is supplied by the vertebral arteries. There are two vertebral arteries supplying either side. They are all connected by a roundabout called the Circle of Willis. It's a little bit complicated, but responsible for keeping the brain perfused, and it's worth knowing about. So let's dig in. We're going to be constructing the Circle of Willis, which in my case is represented by an alien named Willis. It starts with a circle or a roundabout that allows the blood flow from each of the four main perfusing arteries to have access to all parts of the brain. Okay, the anterior circulation is fed by the internal carotid arteries. Here's Willis. His eyes are the internal carotid arteries. The middle cerebral arteries are relatively large and branch directly off of the internal carotids. The anterior cerebral arteries form the anterior portion of the Circle of Willis, popping out like antennae for our alien. The alien Willis has antennae that communicate anteriorly. These are the anterior communicating arteries, and this is a common place for aneurysms. The anterior communicating artery is between the two antennas. Now let's talk posterior circulation, which is fed by the vertebral arteries. First, we see the posterior cerebral arteries, which are basically Willis's arms. The vertebral artery brings the blood flow in. The two vertebral arteries combine to form the basilar artery, and that artery separates into the posterior cerebral arteries, or Willis's arms. This part of the circle is the posterior communicating arteries. The basilar artery is his body. The upside down V for vertebral arteries is his legs. His bra, he is gender fluid, is the superior cerebellar artery. Looks kind of like an S, no? His ribs, they actually look a lot more like French fries. And in France, or even in Canada, French fries are called poutine. And it turns out that these represent the pontine arteries. His skirt, I don't know, is it because he's gender fluid or because he's Scottish? I'm not sure. But his skirt represents the anterior inferior cerebellar arteries. His shoes are the posterior inferior cerebellar arteries. Oh, this one's X-rated. That's the anterior spinal artery, proving that Willis is a man. All right, remember, cerebral perfusion pressure equals mean arterial pressure minus intracranial pressure. And I said before that intracranial pressure is usually relatively constant, but sometimes it's not. The brain is locked inside the skull, or brain box, which is a protective yet solid structure. The inside is divided by dural folds that are adherent to the periosteum and contain the venous sinuses. The falx cerebri separates the right and left cerebrum from each other. The falx cerebelli separates the right and left cerebellum and extends down to the foramen magnum posteriorly. A horizontal dural tent separates the cerebrum from the cerebellum, and this is called the tentorium cerebelli. I mean, the brain is literally the consistency of jello, so it needs a little structure to keep everything where it belongs. There are three relatively fluid components within the skull. The brain, which occupies about 1,300 cc's. The cerebral spinal fluid, which occupies about 130 cc's, or a tenth. And the blood, which occupies about 130 cc's. So if you do the math, the solid skull can hold about 1,560 cc's total. The proportions are relatively fixed, but the total is constant. That's basically just all that fits in there. The Monroe-Kelly doctrine tells us that if any component increases in volume, another must decrease to accommodate or compensate. Anytime more volume is forced into the skull, the intracranial pressure will increase. Remember, cerebral blood flow is dependent on cerebral perfusion pressure. And cerebral perfusion pressure is the mean arterial pressure minus the intracranial pressure. So, if intracranial pressure is increased, it will reduce the cerebral perfusion pressure. An example would be good here. If you saw a brain tumor occupying a large amount of space within the head, that would definitely cause the brain to be smashed. Blood and CSF would need to decrease proportionally. But as the brain tumor increased in size, the intracranial pressure would continue to increase. What if there was a large intracranial hemorrhage? It will compress the brain tissue. CSF may be reduced to compensate, but ultimately the intracranial pressure will increase. So we have established that anything that expands within the fixed space of the skull will ultimately cause reduced cerebral perfusion by increasing intracranial pressure. When the brain does not have an adequate blood supply, it will swell, further increasing brain volume, increasing intracranial pressure. and further reducing cerebral perfusion. Decreasing that perfusion causes more swelling, also called cerebral edema. And this can become a vicious cycle until the brain dies and the patient dies with it. This explains why, when a person has a brain hemorrhage, we allow the mean arterial pressure to be on the higher side of autoregulation to make sure that it can exceed that increased intracranial pressure. But we don't want that pressure to be too high, because if the pressure is too high, it could result in hyperemia and further bleeding, making the situation worse. No one said medicine was easy. A goal of systolic pressure of about 140 millimeters mercury, or between 130 and 150, is typically what's recommended. Note in the picture that on the side of the hemorrhage, you really don't see the sulci between the gyri. Definitely not as much as you see it on the other side. Also, there is a discrepancy with the gray-white border, which seems to become obliterated once you have a hemorrhage, especially when there's edema around it. Now recall that the falx and tentorium are folds in very dense connective tissue that help to keep the brain in separate compartments. But it's not complete. And when the brain swells, the brain may be shoved through the openings in this dense connective tissue. This is called herniation. And when the gelatinous brain herniates through these spaces in the dense connective tissue, nothing good happens to the brain. In the picture, we saw different kinds of herniations. If the skull is broken and the brain herniates out, that's called transcovarial. As we saw in the previous picture, you see the brain shifted from one side to the other. That's called subfalcine. Now, when we go deeper, we really get into trouble. Uncal herniation puts pressure on the brainstem. And you know, the brainstem is what keeps you alive. So this is not tolerated well. And then, perhaps the worst is tonsillar herniation. And that's when the cerebellum actually herniates through the foramen magnum. That puts pressure on the medulla oblongata. And that is typically lights out. All right, what did we go over here? We talked about brain perfusion. We said that there were two pairs of vessels with a roundabout in the middle. And the roundabout is called the circle of Willis. We learned that the circle of Willis can be represented by Willis the alien, and hopefully that helped you to remember the vessels that are involved. We learned about cerebral autoregulation, cerebral perfusion pressure, and cerebral blood flow, and the consequences when you have elevated intracranial pressure.